So an offload delay is when a paramedic crew arrives at a receiving emergency department with a patient. Upon arrival, the crew is initially triaged by the emergency department staff. And typically from there, the patient would be then transferred to a bed. So that should occur within what we identify as the first 30 minutes of the crew arriving at the emergency department. Typically with an offload delay, the hospital is not able to transfer the patient onto a bed because a bed is not available or staff are not available. So the paramedics will continue to provide care to the patient on the paramedic or the ambulance stretcher in the hallway of the emergency department until such time as care can be transferred to the hospital. So quickly I'll talk about the EMS Offload Nurse Program, and that's a program that's funded by the Ontario Ministry of Health. It's funded at 100%. And basically that's funding that's provided to the County of Middlesex, which then enters into a contract with London Health Sciences. And London Health Sciences provides a nurse at both the Victoria campus and the University campus for 16 hours a day for each site. The emergency department EMS offload nurse will actually be able to receive up to 6 patients. There's 6 stretchers that are in the hallway that the EMS offload nurse will take care of. So it actually allows for paramedics to be relieved and get back onto the road quicker. That's the system that's in place right now. The London Health Sciences is currently piloting a new system which is called the Toyota Production System. And that's where patients, whether they're coming in by ambulance or they're walking in off the street, are basically triaged right away and registered right away and seen in what's called the front bubble, and basically it's a faster, I use the word production, to process the patient. It's encompasses lean and Toyota processes to create a better efficient and effective receiving of patients and hopefully cutting down on times. The expectation is that that will ensure that offloads are eliminated or drastically reduced, and that is the goal with LHSC. At this point in time, they continue to model, but they haven't fully implemented this new process. Well, there's a lot of challenges that are facing the system. The first one is an issue that is known to County Council and City Council, and that's the day-to-day control of the system through the land ambulance dispatch. In London, we are controlled through the Ministry of Health, London Central Ambulance Communications Centre. So we do not control our vehicle movements. It's siloed with our land operations and our dispatch, so it's not a coordinated process. We do provide what we call a deployment plan to the London Central Ambulance Communication Centre, but there is no integration of either service. So that's one of our biggest challenges. The other is what we call the medical triage tool. And clearly what that is the province right now uses a triage tool. So when you call in for an ambulance, you are asked, or whoever's calling in is asked, a series of questions to triage the acuity of the caller or the patient that requires an ambulance. The province uses a system that was developed in-house. It severely over-triages calls. And a good example is that in London, or in Middlesex London's response area, we respond to calls, lights and sirens, 65% of the time, and yet we only return lights and sirens about 19% of the time. So there's a huge skew on that. And what that's doing is it's exhausting our system, that everything is going out, lights and sirens, putting the paramedics and the public at risk by racing through the streets, and it unnecessarily is over triaging calls when we're reducing our resources and not really available to respond. So that's one of the areas. And there's a lack of accountability in the sense of there is no service level agreements with our dispatch and no performance targets with dispatch on how they're operating. Especially, are they effectively and efficiently utilizing our resources? So obviously we're putting more resources on the road, which both county and city council, but more importantly the taxpayer is paying for, but we have no guarantee that those resources are being efficiently utilized. So that's a huge concern. The other areas that we have, besides the offload delay issues at the hospital, which we discussed earlier, are issues of, we're seeing in Ontario that the healthcare system is going to more of a community-based system where we're seeing patients discharged from hospitals quicker and sicker. And as a result, paramedic services are becoming a bit of a safety net because these patients are now in the community where they would have been in the hospital longer and under the hospital's care. They're now under community care, which often we're seeing an increase in our calls as a result of this. The other area as well, we're seeing an aging demographic, especially in London. So a good amount of our calls, a high proportion of that is where we basically have our patients are at least 60 years of age or older. And so that obviously is playing on our resources as well. Obviously, we're working with the province on initiatives such as Patients First, their new initiative to look at community-based care, working with the MLEMS and other providers such as CCAC. But those are some of the areas that we're looking at as other challenges for us. So tiered response is an initiative that started back in the 90s under a pilot that the province of Ontario did called the Ontario Paramedic Advanced Life Support, or OPALS initiative. And that was a research project to measure cardiac arrest survival rates. And as a result, tiered response was engaged where fire and or police services would co-respond with paramedics, specifically to cardiac arrest calls in order to increase the outcome of patients and improve the ability for patients to be successfully resuscitated. In London, we have a tiered response agreement with the London Fire Department. In the County of Middlesex, we have tiered response agreements with County Fire Services and with one police service. And basically, the majority of the calls that we have a co-response or tiered response with deal with cardiac arrests. And every year, we actually have a day called the Survivors Day, which recognizes the cardiac arrest survivors that not only Middlesex London EMS paramedics, but also the London Central Ambulance Communications Centre, London Fire Department, London Police Services, and the police services and fire services within county participated in as a joint response and basically helped bring somebody back from a full cardiac arrest to somebody that's able to be recognized and to reunite them with the first responders that helped resuscitate them successfully. So there's two main, if you look back at the history of the type of transports land ambulance services have historically done, and there are what we call the emergency responses. So that's the type of response which is a medical emergency where the paramedics and the ambulance respond lights and sirens. And the other type of call that historically land ambulance services have done were what we call interfacility transfers or non-urgent transfers. I would suggest over the last 10 to even 15 years, a lot of land ambulance services have actually migrated away from providing non-urgent transfer services, partially because of the increasing demand for emergency calls and the fact that many municipalities have non-urgent transfer services that are available. In the Middlesex London area, which is under the Southwest LHIN, the Southwest LHIN took an initiative where they created a chart to identify when to call an ambulance. And under the Ambulance Act of Ontario, ambulances should only be transporting a patient, especially from a hospital where the patient is critical, requires a stretcher, and has an escort. So basically the patient's unstable. Where a patient is stable and or does not have an escort or require an escort, but still may require a stretcher, non-urgent transfer services such as in London, Voyageur, and other services throughout the province literally do these calls, and they're paid for through the hospitals, because typically they're taking a stable patient from one hospital to another hospital. So there are two main types of services, or paramedics, that we have in our service, and I'll also talk about the third type that are in the province. So in our service, we have primary care paramedics, and primary care paramedics are required to take 2 years at a community college within the province. Once they're completed that community college, then they will write a provincial exam, which is upwards of 6 hours, and upon successful completion of that exam, then they are awarded sort of a license to work in the province by the Ontario Ministry of Health. Once that is received by the paramedic and they're employed by a licensed ambulance service, then they will go through further certification and training by the regional based hospital program under which the paramedic service operates. And so that's the medical director, which we talk about during our presentation. And the medical director will then sign off that newly hired paramedic and put them under their license. In Middlesex, London, we also have a bit of a nuance where we have what we call primary care paramedics who are IV certified. And that basically allows the paramedic to start an IV while they're on scene under the medical license of the base hospital medical director. The other type of paramedic that we employ within Middlesex London EMS is called an advanced care paramedic. So basically it's the 2 years of training that we talked about with a primary care paramedic, plus an additional year's training. Advanced care paramedics provide basically advanced procedures, very similar to what you would consider an ICU nurse, or a lot of actually medical procedures that only physicians can provide. But again, they're operating under the medical direction and under the license of the base hospital medical director. Okay. So the third type of paramedic that operates within the province of Ontario is called a critical care paramedic, and they're more advanced than the advanced care paramedic. Primarily what they are trained to do is to provide treatment to critically ill or injured patients, and they operate within the realm of Orange or with a critical care land ambulance. And their specialty is just being able to transfer or transport a critical patient from one facility to the next. So basically, they're on patient transfer type of calls. There are 4 codes. Codes 1 and 2 primarily are utilized for non-urgent type of transfers, which typically Middlesex London EMS does not do. They're primarily done by private transfer companies such as Voyager. The next priority is a priority 3, and that's considered a prompt call. That's no lights, no sirens. And the type of call that would primarily would be for a patient that is generally weak, but they're conscious. They may be dealing with nausea, vomiting, or they may have injured themselves, but nothing serious or critical. The next call is what we consider lights and sirens, and that's a code 4, and that would be for the most life-threatening type of calls. So cardiac arrest, somebody that stopped breathing, somebody that's having a stroke, somebody in a motor vehicle collision that's, their condition is considered critical or unknown. And typically, Middlesex London EMS responds to about 65% of our calls are code 4, but we come back 19% that on a code 4. So it's a huge medical triage issue, which we'll talk about during our slide presentation. The next code that we primarily respond to is called a code 8, which is emergency coverage, and there are 2 types of code 8s. One is dealing with when we redistribute our available vehicles throughout the system because the system is getting low on resources, so it's sort of like moving chess pieces around on the board to provide optimal coverage and response capabilities. The other type of code 8 that we provide is for other emergency service partners such as police and fire. So for fire, if they're at a working fire where firefighters potentially are at risk or the public is at risk, we'll be asked by the fire department to be on standby or on location in case somebody gets injured. The other type of emergency coverage that we provide is for London Police Services or for the Ontario Provincial Police Service or Strathroy-Caradoc Police Service when they're at a scene of a high-risk takedown or at an area where there may be injuries involved or patients may be injured or affected as a result of an event that's occurring at that time, and we'll provide backup to either the police or fire services.